Cancer back to the limelight here. And joining us now to discuss is Newsmax medical contributor Dr. David Samadi, author of this book, The Ultimate Manual, A Guide to Men's Health and Wellness. Dr. Samadi, thank you so much for taking the time. And I want to get to you, the topic of getting children vaccinated, where that stands in just a moment. But back to this point about prostate cancer awareness. If you could kind of, for the general public to understand, what's the appropriate age to get checked for this? What are some of the risk factors? Talk to me about that.
Well, I think this is a newsworthy, and of course, this is my field. My expertise has always been prostate cancer. So I always encourage people, if they have a high-risk family, African Americans, or if they have first-degree family with prostate cancer, always get your PSA or blood test for screening at the age of 40. And then annually, you need to have the exam and also look at the trend and the velocity of that test. What we learned from this study is that prostate cancer is not an old man disease anymore. We see a lot of patients in my practice in the early 40s, 42, 47-year-olds, 59-year-old in the case of Gunther, that have prostate cancer. So it's not an old man disease. Don't wait until you're 65 or 70 to start worrying about prostate cancer. We also know that this is a silent killer, and there are no symptoms. By the time you start having symptoms, it's already too late. So given this pandemic and COVID and the fact that a lot of people really missed their PSA screenings, their exams, we're starting to see a lot of aggressive prostate cancer patients, which could have been completely avoidable and curable, and now they end up having more of treatment. And for a lot of people, obviously, who have questions or confused or they're newly diagnosed with prostate cancer, we started this website called prostatecancer911.com. Prostatecancer911.com. They can send me their messages, especially for Newsmax viewers and others, and we're happy to help them directly and save lives.
Absolutely. Let's do that. Let's save lives if testing can do it. So are we saying anyone 40 and up maybe get tested?
Absolutely. I think it's good to have a baseline and then look at your labs and always talk to a doctor and get a second opinion.
Okay. I want to absolutely.